Are you a physician? Are you a nurse? Do you work at a hospital or clinic? Do you think that you might be missing something in your digital healthcare landscape? Is your system frustrating you because you think it should do something, but you've been told that it can't? Do you think that there is some untapped potential in your EMR? Hi, I'm John Lee. I'm a practicing emergency physician. I'm also a clinical informaticist and have multiple Epic Analyst certifications. Because of this, I have a unique perspective on how our IT systems and EMRs can work with healthcare. My goal is to spread the word about what we can do with our digital systems, and I've created what I'm calling informatics shorts to highlight how I think we can improve how we use these systems. Recently, I received an unsettling phone call from a worried family friend. Her husband had just been admitted to the hospital for newly diagnosed heart failure and had recently been released. He did recover, but they had a confusing discharge process. My friend was stressed because she was given 40 pages of discharge instructions, which were very confusing. She didn't know which new medications her husband was supposed to take, and she was confused about their intended uses and side effects. They also didn't receive good information about his new diagnosis. They were confused about what to expect and what they were supposed to do. I was able to help them understand and make the right actions. But if I hadn't, I think he would have ended up hospitalized again. As I helped them, I thought of the opportunities we have to use information technology to solve these sorts of problems. What can we offer people who don't have an ER doctor as a family friend? In the past, we didn't really have good options, but technology has really opened the doors to many new possibilities. For example, the first thing I did was help them understand what to expect from the new medications. I gave them directions on how to take the medications, what effects and side effects he should expect, and let them know which old prescriptions he should stop. I explained this to them in plain English without medical jargon. This made me recall a project where we used the EMR to detect newly prescribed medications. We then used the data linked to the medications and attached information that automatically displayed this content in simple language that made it easy for patients and their families to understand. This sort of function is just a small example of what these systems can do, but are often unused. In fact, many organizations don't know that you can do these sorts of things. The reality is that we often don't fully leverage the data and tools in our EMRs. My experience is that we often leave big chunks of functionality untapped. Even with smarter EMR tools, medical information can still be overwhelming for patients. Smarter instructions are better, but not enough, especially with complex patients. Patients and their families often need a helping hand, and this help should not be difficult to get. This is an opportunity for telemedicine. Telemedicine facilitates access to clinical staff, but with less hassle than the traditional, we'll see you in a week follow-up office visit. For instance, it would have helped my friend to have a nurse do a short 5-minute check with him on the day after discharge to see how he was doing. Was he in pain? Did he look short of breath? A pharmacist could have also done a live review of his medications and had him show his bottles before the morning doses. Did he seem confused about his multiple medication changes? Did he understand how the medication should make him feel? Did he know what were the side effects he should watch for? I also instructed my friends to monitor 4 sets of numbers. I had them monitor his weight, pulse oximetry, heart rate, and blood pressure. If the new diuretics caused him to lose too much fluid, he would lose weight rapidly, and his blood pressure would go down, possibly even causing him to pass out. Or he could gain too much weight and experience worsening pulse oximetry if his diuretic is ineffective, which may indicate increasing fluid in his lungs. Either of these circumstances would allow his doctors to tweak his medications before he had complications that would require him to go back to the hospital. Basically, I had created a makeshift remote patient monitoring system. We made it work, but we have technology that can create the same sort of thing without having an ER doctor on speed dial. While dynamic electronic medical records, telemedicine, and remote patient monitoring are all currently technically feasible and available, if you talk to patients and clinicians, these tools aren't used as well as they could be. We need to start thinking about how to better use these and other modern information tools if we are going to fix our broken healthcare system. Every day I work in the ER, I see opportunities to improve information delivery that will improve care. We have the technology to bridge these gaps, but we need to use our technology better. Connect with me on LinkedIn or check out my website, and let's fix healthcare together.